Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Hi, everyone, and welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker. This is the place where healthcare workers come to be seen and heard. Now, as we've been talking over the last several episodes, we've been really focusing on the 7 Remedies of Being. And so some of you have brought up the question, well, what exactly is a remedy? Well, initially, and we know this in medicine, it's a healing medicine. And so that's why I thought it was a very appropriate label for what we're doing because we're trying to heal ourselves. It's also to make something right and also to restore it back to its natural and proper entity of whatever it was prior. So this is what we're trying to do. We're trying to get back to our own humanity and be human beings and not human machines. Now, the 7 remedies, as you recall, are the physical being, the mental being, the spiritual being, and the sensory being, and those are our internal beings. Now, the other ones that we talked about, there are 3 that are beyond us, right? These are dealing with other people, and that is our relational being, our community being, and our intentional being. So today I want to really focus on the community being, and I really want to focus on the healthcare community. And really, I feel like we are very disjointed as individual. We have all these little micro communities because we have the physician community, but within the physician community, there are all of the specialty communities and all of the subspecialties within those communities as well. But we also have the nursing community, and there are multiple communities within the nursing community. I know that I work with the OR community, and so AORN is a big community within our nursing community in the OR. There are multiple ones, right? And there are also multi-layered ones throughout all of healthcare, and everyone has their each little mini group. And that's great because I think each of those groups provide a community that are very specific to each of our needs. The problem that I think we're struggling with is that healthcare is a team sport, right? Everything we're doing in healthcare is not just one person. And when I go to work, I have an entire team that is supporting me. When I go to the OR, there's an entire team supporting me. If I have a patient that is admitted to the hospital, there's an entire team supporting me. And when one of those team members is not present, it really jumbles up that whole process. And everyone is incredibly valuable. And there isn't one person that is more important than the other. We all work together, but there is a lot of conflict, I feel like, that goes on. I know that happens in the physician world and across specialties. It happens with physicians and nurses and physicians and other staff. It's all interconnected. And so one of the things that we have to really work on, and I'd love for you to put in the comments suggestions that you all have. I think that the nurses have a great idea. They're trying to unionize. And so they're trying to get a collective voice saying, we have needs. These are the needs and they're not being met. And this is what we need. And if they're not going to be addressed, then we're not going to come to work. And that's really what we all need to be doing in healthcare because there are so many layers and so many problems in healthcare. And the problem is that we are focused on taking care of patients and we're doing this day in and day out. And we don't have the time and we don't have the expertise to be able to organize and collaborate. But this is something that we're going to have to change because you cannot expect to have your voice represented when your voice doesn't show up at the table. And this is what happens over and over and over again. And there are many people having conversations about healthcare in general and how it's supposed to be, except that the people who are doing the healthcare aren't sitting at those tables. And the needs of this healthcare community aren't being voiced. And so I feel like when we look at our community, we have a healthcare community, we have a personal community, and that's when we go home. But for in this particular community, we're going to have to do better. And we need to advocate for ourselves because no one's asking us. The insurance companies are not asking us, wow, how can we make things better for you? How are you doing? Do you feel happy in what you're doing? How do you feel in the relationship, doctor, with us, insurance company, and how our relationship is going? And how do you feel our service is to you? Right? Nobody's asking that. Nobody cares about us. We are not valued in any way. We are just pawns in this relationship between patients and third party payers. And we have inserted ourselves into that. And now the insurance companies don't care. The patients don't care about us. And no one cares if we get paid. No one cares about how we navigate medicine. We're being dictated by insurance companies. So we're going to have to work on really advocating for ourselves. And we have to do this for each other as well. And the thing about it is, if you ask all the people, it doesn't matter what job that they're doing, like, why are you in healthcare? And essentially, it's like we really want to just help people. We want to serve and we want to do great things. And we want to take people out of these really hard situations and help them get to a better place. Universally, that's kind of the overall collective of this entire community, except that that's really not what is being portrayed. And we need to we need to acknowledge each other when we walk in the hospital. We need to smile, we need to greet people. I see you, you matter. Talk, how's it going? And it's not the fine, fine, living the dream, another day in paradise, all the things that we say, which is the I don't have time to talk about how I feel. You don't really want to know how I feel. How I feel doesn't matter, which that's the translation for a lot of these things. And it doesn't matter. And, you know, it's a very interesting thing. When I was a resident and I worked at the VA, I loved working at the VA because I loved all of the veterans that I took care of. And I would come in and I would say to them in the morning, "How's it going? How you doing today? How you feeling?" And they would say, and this was universal, like this entire group would say the same thing. And many of them were just like, "Oh, doc, can't complain. Wouldn't do any good." And that's kind of how I feel all these years of, well, what's the point of complaining? Because it's not going to do any good. No one's listening. And we have to start listening to each other. And more importantly, we have to start asking each other, what's going on? How are you? Are you okay at home? Are you okay at work? And then stop and close our mouth and stop talking and open our ears and listen. And also get back into our multi-sensory person because we have to use all of our senses when we're talking to our colleagues, but we have to go beyond and we have to listen to our gut and we have to use our intuition and use all of these other senses that we have of like, are we really okay? Is this person doing okay? Because if we talked about in prior episodes, physician suicide is a real deal. And again, this last year, we've got 3 physicians who have died by suicide. So they're talking to people before they kill themselves. And we have to be paying attention. And I want to wonder how many people had an intimate contact in some way, some moment, and it just passed so quickly and we weren't paying attention. And maybe we're going to overpay attention for a little while. And I'm not sure that's a bad thing because maybe it's better to say, no, no, really, it's good. I'm fine. I'm just really tired. I was on a long call shift or whatever. No, I'm okay. I would rather some reassurance and some extra explanation about why and how we're doing well rather than missing something like that. And I think we need to make time to talk with all of our colleagues about our medical experience and our personal experience. And I think that, maybe the day starts with, hey, how's it going? How's your family? How are things at home? I know for me, the mornings were always crazy, and it's great to offload some of the personal struggles before you start to see patients. It's great to have a few minutes with the people that you're going to spend the entire day with, right? This is your other family, your healthcare family. And they know, they know when you come in the morning, you're a grouch and you're going to be grouchy the whole day. And now they're just like, wow, now we got to put up with this person and she's grouchy all day. So the patients deserve not to see a grouch either. And so beginning to offload some of that on a daily basis, because the thing is, if we're just doing it in little bits, it takes a minute. It's not taking 40 minutes. And so we need to do this on the back end of our day, and we need to, it's almost like a debrief, right? When we start in the hour, we talk about what's our plan, what are we going to do for the day, and what's this procedure, and what are all the things we need, do we have it? So we're making our plan for the day. At the end of the surgery, we debrief. And I feel like we need to debrief the end of our day and say, how did it go? How was everyone feeling? What were the struggles? What were the successes? And trying to walk out with the successes really at top of mind. But at the end of the day, as best as possible, leave it, because that's not ours necessarily to take home, and leave it there. It's going to be there. It's always going to be there. There's multi layers, and certainly if you're on call, there's other things that you're going to do. But you've got to be able to leave it to be able to show up for the next person in your life, whether it's your family, your kids. Maybe you have a meeting after work and you're working on something else. You've got to debrief that. And again, I think as colleagues, the nurses can get together at the end of the shift and do a roundtable. Everyone's done their thing. Okay, everyone has to be done with checking out by this time. And then at the end of the shift, all the new shift, they're shifting on and they're going off to work. They do whatever they're going to do, and the off group sits 10 minutes. Everybody gets 1 minute to debrief about what happened in the day and how you felt about it, and what you need. How can we as a group support you? What do you need right now? And I think as we do this on the daily, every time that we're coming to work, that it helps dilute all of the pain and toxicity that we deal with on a daily basis. And we have to let go of that, because that residue sticks with us and we carry that. And that's what ultimately is going to put up walls. And the thing is that we're all in the same battle, right? And so when we build up walls with each other, it's just not going to work. And we're not going to be a team. We're going to be a bunch of individuals with all these shells on us bumping into each other. It's not going to work. I'd like to talk about stopping the violence and harm to ourselves and our families. This, this really, when we get home and we don't unload that, this does harm them. I think the death of us harms them. And I think we have to be talking about suicide more. And it's not fair to them. And they didn't choose to go into medicine, we did. And so we've got to do better about managing ourselves and taking care of ourselves, because they don't necessarily have the understanding. Like when I say, you know, patient so and so was going fine, and then they dropped, and then a code ensued. Everyone who does healthcare knows what a code is, and all the intricate details and how horror show that is for that patient, and it can be if there's family there, and for us potentially as well. uh, our families, they don't understand all that. So we have to stop harming ourselves, but we have to stop harming each other, and we have to stop not supporting each other in a public forum. And so with the internet, I feel that we have so much access to so many different things, and we can bash people and we can say, well, this or that. And what we're not saying is, how can I best help you? Here's my hand. How can I best lift you up? What do you need? How can I best serve you? And the thing is that with this as a well-oiled machine, when we're taking care of ourselves, it's translating to good patient care. It's also translating to good relationships with our spouses. We need to create restrictions of treatment time. And this is something that the residency programs have done, and they have said, these residents can only work this number of days and these hours and these days, and they need off time. And the problem that happens is that is actually not how the real world is. And so we're setting up these people to fail. And we have all of these people in the community who've been practicing after you finish residency that come out. And some of us, like myself, we've been trained for what we're experiencing, because at the time that I was trained, there were no workout restrictions. You just worked and you worked and you worked, and every other night call. And sometimes, when I was a second year resident, I went in on call on a Saturday morning and I went home on a Monday night. And that was the expectation. That is not the expectation now, and for good reason. And so the thing is, we're training residents with time restrictions, but then we're putting them out and we're expecting the entire community, especially physicians, to practice outside of realistic time guidelines. The thing is, we now have pilots who, if their shift is going to exceed a certain time period, there's another shift that is available that will replace them. And I can tell you that shift is not 48 hours. And I do know that there are some trauma services that are carrying 48-hour call. I think 24-hour call is unnecessary. We have enough people and enough time to be able to shift in 12 hours. 12 hours is a long shift. And the thing is that we are harming ourselves. We are harming our brain. The literature supports this. We are creating this situation for dementia, and no one's talking about that. We have people who are working on a night shift. That's going against the nocturnal rhythms. We know this. And so when we look at like the risk of having cancer, we're now talking about night shift workers as an increased risk for cancer. So all of these things, we are harming ourselves. And when we look at, a pilot, they are flying and they're in the care of all of these people. Well, we're in the care of multiple people all simultaneously as well. And no one is paying attention to whether or not our quality of health is proper. The pilots have to go through physical exams. We don't go through that. I have people who haven't even had mammograms yet, and they're well in their 50s. So, blood work, EKG. What if you're not fit enough to operate? And I mean, we're all going to have things that happen to us, but everyone is so paying attention to pilots and their quality of health. Oh my God, these 300 people on the plane, their lives depend on it. But yet we're day in, day in, day out, taking care of people where their lives are already compromised coming in, and we're expected to make it better and we're expected to have quality care, except that no one's asked us, what are we doing? How are we doing? Are we okay? Are we all right? Are we healthy? Are we physically healthy? Are we mentally healthy? Are we capable of doing this job anymore? And we have people who have aged out of this job and they're still practicing. And we don't have a way to even talk about that. And there's just some people who it's just time. It's time to have the conversation of, okay, well, you have been amazing in healthcare. And now what can you do to transition out of direct patient care and still be valuable in some other capacity? And that's physicians, that's nurses, that's all the healthcare positions. We have to be mindful about our physical and mental strength to do the job that we're doing, and no one's talking about that. We need to support our colleagues, um, and for being present with their families. When somebody has a death in the family, everyone rallies normally. But in our community, the first thing we think about is like, all right, what's the call situation going to be? Who's going to take their shift? Or if somebody gets hurt? And we're even programmed to even, that's our first thought with an injury is, what am I going to do for my call shift? And I'll tell you about a time we were skiing, my wife and we were going down, and I had gone down this run, and she was right behind me with one of our other friends. And so I get down and I'm waiting, and I thought that they had gone ahead of me because I had kind of tweaked my knee, and so I was not skiing my usual. But as it turned out, I was ahead of them, and I'm waiting, and they're not there. And then finally, the ski patrol comes down to me, and they say, um, "You're Lisa Hunsicker." I said, "Yeah, how do you know?" And they said, "Well, your wife said you would be the one in the highlighter yellow pants." So they knew exactly to come up to me. Well, as it turns out, she had crashed skiing, and she had broken her arm. She had broken multiple ribs, and she had a flail chest and a pneumothorax. And so now we begin this whole, episode to bring her down. We've got to get her off this particular run, but we're still in the back country. And so then we have to snowmobile her in and then get her to the hospital. And so, I'm talking to her as we're packing her up to go down, and I take her phone. She's supposed to be on call on a 24-hour trauma call the next day. And I said to her, I need to have your phone so I can call for you. And she said, "Yeah, yeah, I need to let them know I will not be on call tomorrow." Like, right, that's right, you're not. But also, you're not going to be on call for a little while, so we need to start working on that as well. And her reflex response was like, "No, no, no, we'll take care of this today." Now, this is a trauma surgeon. She knows exactly what's going on, and she knows all the broken parts she has. But in that moment, her allegiance is to the call schedule and making sure no one is put out with the call schedule, and that she's going to be right back to it. And she wants to reassure every one of her colleagues that she's coming. Like, it's no big deal. This is a big deal, right? We're on the way to surgery. This is a big deal. And so we rearranged the call schedule. She took 2 months off. She healed. She's fabulous. But in that moment, her thought is has nothing to do with her. It's not even survival at that point. It's immediately, how am I impacting all these other things? And I think we have to get to the place of grace of, you know what, everyone's going to have a family death. Everyone is going to have a sick kid at school. Everyone is going to have a terrible event that happens at work that impacts you so much that you need to step out of that situation and you need someone to back you up. And I think that we're not giving each other grace because we are so dedicated to protecting and holding our ground, and we're slaying the dragons all the time. And this becomes another dragon that we're going to have to fight, and it's one of our own dragons. And we just have to let that go. And if that was your best friend calling, you would say, "Hey, no problem. I got it. I'll take care of you. I got you. We'll figure it out. Just do what you got to do. I'm going to take care of you." But we don't have that, and we're so tired, and we're so depleted, and we're so walled up, and we're so disconnected from our hearts that we're not being present for each other in a very human way. And I think we have to really start doing that and giving each other grace. And we need to talk about these plans in advance, because what I feel is happening is that we have these occasions, and then there's this big hubbub around it, and then it gets worked out, and then everyone is like, "Whew, okay, we got past that, now we're back to normal," and then we're going on. And then the next one comes, and It's like a new day over, it's Groundhog Day. It's over and over and over again. It's the same thing, but the content is different, but it's still, there's a little shift and shimmy. And so we need to be really mindful about layers. And I feel that many of the other staff do this, but as physicians, I don't think that we have a good plan to how to best support each other and to allow each other to be present for our families in times of need, especially in a time of a family crisis. I think being sick is the thing that we never really talk about. And while we just talked about my wife's ski accident, sometimes you're going to wake up and you've got COVID, you've got the flu, you've got a GI bug, which I feel like that's the trump card of all things because you're stuck on the toilet. And the thing is that we continually work through those things and we teach people that we're going to just keep working through them. And I think physicians are the worst at this. And there are no really good guidelines of sickness. And I think we have to learn how to explain this to patients because patients have been waiting to see us and they've moved their schedules around to see us. They have gotten family members perhaps to join them. They've got a problem that's been a lingering problem for some time that they're in pain, they're struggling with, and they just need to see us to get on. And we don't want to disappoint them. And sometimes you don't want to do it because some of these patients and they're not pleasant. And dealing with them on a good day is unpleasant. And then when you have to disappoint them, like you just don't want to hear their voice anymore and have to deal with them. And I understand that. So we still have to figure out ways to be human and be sick because we we just can't get around that. And I feel like we need to come up with a better way for us to organize ourselves, talk about this ahead of time, and plan. And it's not just a PTO thing, right? Because you don't get to plan these things. And if you wake up and you have a GI bug and you get food poisoning, you get some flu, right? You don't get a 10-day advance warning saying, well, I'm going to have a GI bug in 10 days, so let's rearrange the schedule. It's a in the moment thing. So let's really work on that. And if you all have suggestions that maybe perhaps you've already thought about this and your group is doing something in particular, please put that in the comments. And also, send me a direct message on Instagram at Soulful Surgeon. And I would love to hear these because I would love to interview you on the podcast and I would like to bring this out so that we can have more open conversation about this because if you've already done it, there's no sense of us reinventing the wheel. If you figured something out that works great, please let us know because it's something that we need to disperse through all of our community. I want to talk about boundaries with our staff. Um, we're very cautious, right, as business owners, perhaps. And it's really important that the staff get breaks, they get protected time for lunch. If it's a woman who's breastfeeding, she's getting protected time to be able to breastfeed. And this is a model throughout corporate America. And that's the standard. And in many cases, in the hospital world, that is the case as an employed staff. Maybe the nurses are shifting on and off, but they're getting dedicated breaks. I know in the OR, our staff are coming in and out and they're taking breaks. We're not taking any breaks as physicians. And so I know that my lunchtime, I'm typically trying to catch up from my morning clinic because patients are late or I'm late or any number of other things that are going on and patient emergencies. All those things go on simultaneously. And so lunch is an overflow to try and get caught up. But we need to eat. But those are meetings that are being set and you've got to go here, you've got to go there. And then the staff say, I need you, I need you, I need you. And so we have to build into our schedule perhaps 30 minutes for the staff to catch up with us so that we can get them the information because they have the patients on the other end. trying to get information and we're not available because we're seeing patients or I'm operating, I've got to be able to build in some time frame where I check in with them and say, okay, what do you need? And maybe we do this right after the morning clinic, right after the afternoon clinic, or sometime if you get a break. But we're not doing that for ourselves. And we've got to be able to step away and catch your breath. And going to clinic or going in the hours like running a marathon where you're not stopping to eat or drink or even go to the bathroom. And I don't think people understand. Like, I just need 2 seconds. I've got to go to the bathroom. But it's like, no, you're late. You got to keep going. And this is driven by us. It's not anybody else self-imposing on that. And so we have to succumb to our own needs, and we need to go to the bathroom. We need to eat. We need to catch our breath. We need to clear our mind. We need to deal with whatever we've dealt with in the morning. And again, it's this offload. You've got to take what has been put upon you and you've got to connect back to yourself and then get your walls down, be you for a short while, and then put your shield up as you need, but still go on and lead in your clinic and lead with your colleagues with a heartfelt and heartful approach. That's what's going to make us better, but we have to have that for ourselves. And we've got to build that in. And we have to teach our teams to respect that because if we don't respect it, they're not going to respect it. And I think it's great to say, look, I need you to hold me accountable for this. And so you have to protect me from patients, from phone calls, from emails. You have got to protect me so that I can just put food, you know, right in my mouth and get on. So I'm available mentally, physically, spiritually, sensory wise, ready for the next clinic, the next OR, whatever our next patient encounter is. One of the things that we need to talk about is how physicians can create some sort of community where we need to protect ourselves from insurance companies. We need to protect ourselves from Medicare and the lack of care that is associated with Medicare and the lack of pay and the lack of care of us and our relationship with our patient and who we are as people with Medicare and the third party payers. Medicare just keeps reducing their rates and they just think that we can just keep going on less and less and less and less. And if you are an employed person, that's the employer's problem, not yours. But as many of us are in private practice, not only are we the physician or the nurse practitioner or the PA, we are also the business owner. And our reimbursement is diminishing, but our costs are going up. Everything is going up. And nowhere else would anyone step in. If you went to McDonald's to get a burger and McDonald's set their price, and I just went and said, no, you're going to accept this. You're still going to have all the same expenses, but your hamburger is going to be a third of what you're charging people. That would be absolute ridiculousness. And they would laugh at me, and everyone would publicly think that's a ridiculous thing. And the law would support us in saying, you can't tell people what to charge. They own their own business and they can do what they want. Well, here's the thing. We've stepped into this relationship with insurance companies and patients, and now we are being influenced in that way, and we need to step out of that. We all need to leave insurance altogether and let the relationship be between the patient and the insurance company. That's who it's worth. The insurance company charges the patient, and the patient gets the contract with them. Doesn't mean we abandon patients. But what we do is we practice medicine the way we feel it's properly done, not based on a healthcare plan telling us what they think is right and proper. They're not a physician. They're practicing medicine without a license. But we can do it. We can practice medicine and we can do the right thing by the patient. And we can also be out of network. And the patient can have a contract with us and they can pay us, and we can also help them, and we can give them all the paperwork that they need to go back into their insurance for reimbursement and let them deal with the entire environment of third party paying. And we don't have to chase that anymore. It's our choice, and we need to choose to step out of that relationship. Initially, when we entered in, it was good. It made it easy for patients and doctors. We got patients easily because they were in network, and we were able to see lots of patients, and it made it all wonderful when it started. That's not the case anymore, and we just need to choose to step out of that. We also need to really talk about malpractice and be protected from malpractice, because that is ruining how we practice medicine. We do tests that are unnecessary all the time, and we do it based on insurance stuff. We know these things aren't necessary. We know the right test to get you to the answer right away, but we have to do 4 other tests to exclude things. We already know, we're trained physicians, but the insurance company is telling us this. And we're doing it because of malpractice. Well, doctor, you didn't do this, and the standard of care was this, and you didn't do it in the way that we liked. And by the way, maybe you did it perfectly, but the outcome was still bad. And so the patient was going to die anyway, but we're going to make you liable for it. And we're going to take all your money. We're going to take your personal possessions and take your practice. And we're going to drag this out for years, and we're going to publicly destroy you. So we have to work on this. There has to be a better way. I don't know what that is. And anyone who may be an attorney who is watching this, I please and please put something in the comments, DM me, anything that you think is helpful to help with that, because we have to protect ourselves from malpractice running medicine. And we need to be protected from the public. And again, we are assaulted over and over and over again, both physically and emotionally. We have to do something. We need to address this with the public. There needs to be a set of rules. There needs to be a consequence to patients. And look, if you come in and you harm the staff, you go. You just go. That's an automatic discharge. Like, you get to leave. You don't get to treat us this way. And anywhere else, these patients doing these behaviors might even be arrested and taken to jail, but because they're in the hospital, there's some special protection of them and not us. And so there are healthcare workers who've actually been shot and assaulted in hospital. So we have to do something for that. We deserve we deserve many things, and I think it's time for us to start saying what we deserve. And we deserve to be paid for the quality work and the care that we deliver. We deserve to be able to take care of patients the way that we know in our hearts is the best way and is backed scientifically. We deserve to practice human, loving care to patients. And it can't be fear based out of litigation, and we can't be practicing defensive medicine. That's just not in the best essence of care for the patient. We have to stop that. We have to figure out how to do that legally. And anyone who has good ideas with that, please contact me, put it in the comments, let all of us know so we know and we can incorporate it into our practices. DM me. We deserve to be respected, and we deserve to be valued. We deserve to not sacrifice our families and ourselves for the good of other people. And I don't know about you all, but in the words of Patrice Washington, I love this because this is the essence. I am no longer going to set myself on fire to keep these other people warm. I'm just not going to do it. We can't do this. We have to respect ourselves, and we have to respect our families. And we deserve to be heard because we are worthy. And we need to come first over everyone. You know, when we get on the plane, the first thing they say is, when there's a loss of cabin pressure, put your own mask on and then tend to others. But what we've been taught is to asphyxiate and die in the process of taking care of others and neglect ourselves. And so we have to start taking care of ourselves and taking care of each other. Now, we have a whole personal community, and I think this is something that many people may not take advantage of. We have our social communities, all of our hobbies. We need to be other people besides doctors, and we need to offer ourselves in ways that are not medical so that we can fully expand who we are as human beings. And I have lots of hobbies. Many of you know I'm a scuba diver, I'm a race car driver. I love to be outdoors. And so it's great for people to see me as a doctor just being a regular person because it lets them know that I'm just the average person, right? There's nothing different, nothing better or worse about me. They can come and they can talk to me if they have questions about medical stuff, but really when we're together, we're talking about cars. And I just get to be Lisa, the race car driver. And in diving, I love that. I love being underwater because it's quiet. No one's talking to me. I don't need to do anything for anyone. And my safety is my own. And I'm constantly taking care of myself to watch my air, watch the people I'm with. And it's something that I've been able to enjoy with my family because we've been all certified and we've been all able to travel together, vacation together, and dive together. One of the things that I love, a community that I'm part of, is called Kids Sea Camp and Family Divers. They're based out of South Carolina, but they dive internationally. And this is something that has been really great because I have been able to step out of the doctor role. I get put in that role sometimes, as we all do. Every one of you, no matter where we are, if people know that we are in healthcare, we are automatically gravitated to when a medical issue comes up, and that's fine. But in general, we just want to be people. And I love Kids See Camp because I get to see and work with exceptional professionals who are in charge of our safety and really get to see kids develop. And so I've been very fortunate. I've been diving since I was 19, and I am a dive master. So I am able to help on the dives more than just a way of a spectator. And so these are gifts that I have that are not necessarily related to medicine at all. It's something that I've been doing as a teenager, right? And so I brought these skills with me and experiences so everyone can benefit from me and they can see me as Lisa the diver and Lisa the girl who dives as opposed to being the dive instructor. Margot Payton and Tom Payton own Kids Sea Camp, and you can check that out if that sounds like something that you're interested in. They're on the web and they have just taken care of so many families. And I like that because I love the effect of them taking care of me. I'm building time into my schedule and my family because we are a two surgeon household where we're taking care of everyone else's needs. And so it's great to be able to just go and have people pay attention to us. They see us and they hear us and they know us and they want to take care of us. And then they want to make sure that we're spending our off time with our family, having a great time. And the kids love this as well. So whatever it is that your hobby is, go figure it out, go connect with your community. I think the other thing is that volunteering, which, some of you are like, I don't have any more time. And I get that, but I think it's important for us to donate our time, even though we feel like our donating time in the office because we're not getting paid the way that we think that we should. And many times we're writing stuff off. I have operated on more people for free and actually cost me money than I can even imagine to tell you. It would make me throw up even getting a number with that. This is something completely away from work as physicians, as nurses, as healthcare providers. It doesn't matter. We are not those people. We are just going and we are serving people. And this is really what we went into this healthcare thing. We wanted to serve people. We want to help people. And maybe we're helping kids learn how to ride bikes, right? These are simple things that we have the knowledge and skills to be able to help someone who doesn't. And we have all these little micro communities that need our help, and it's very easy for us to step in for an hour, for a couple hours, And there's no big long-term commitment, but we can impact people. I mean, just imagine you teach a kid to ride a bike who then goes on and drives a motorcycle, becomes Tour de France racer. I mean, there's so many ripple effects that we can have when we're taking care of our own communities. And also mentoring. And this is something that we have kind of gotten away from because we're so busy, and in many cases we're bitter about what we're doing. But sitting down with young people, and maybe it's in the area of medicine, maybe it's not, maybe it's someone. My training before medicine was in science, and certainly I have a strong basis in chemistry, and I worked in the chemical industry. And so that would be something I could mentor a young person who thinks that maybe they want to go into chemistry as a profession that's not even related to medicine in general. So we have these other assets and attributes to us, and so many layers of who we are that we kind of forget that we have, that are essential in keeping this really beautiful community alive and vibrant and so diverse. So we can impact people with very little time. And the feeling that you're going to get, which maybe you don't get at work, this is something, these people are going to be so generous with their appreciation. And many times I know I've come home, I'm like, I just wish someone just once in my whole day said, "Gosh, Dr. Hunsicker, thank you so much for what you've done. Thank you so much for taking care of me. Thank you for this or that." But there's many cases we don't get that acknowledgement. But in our communities, everyone, especially when you're donating your time, is so grateful to have help and someone who cares about them and sees them and helps lift them up in some very simple way. So consider that as well. If you have any other suggestions and any other communities that you think would be great, let us know. Put it down in the comments section, DM me as well. I would love to put this on a podcast. So let's bring as much information so that people can reach out, because we have a large community of people who are constantly giving and giving. And let's find great ways for us to feel good while we are doing that. So thanks again for listening for our episode today on relational beings. Take care and be well. Thank you for joining me on the Soulful Surgeon Podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.